from Oregon is
Thank you, Mr. Chairman. Mr. Secretary, welcome back. I must say you look increasingly distinguished.
More like you, huh?
Well, not that distinguished. Thank you for joining us. I want to thank you for the work that the department has done working with the state of Oregon and I think Massachusetts, dealing with innovative efforts in terms of the waiver, being able to focus on social determinants of health that actually help people with things like nutrition and housing that will lower costs. I appreciate the creativity and look forward to working with you and the department to realize the benefit of those. I would, as you know, be remiss if I didn't mention one of the topics that we've discussed.
I see the chart.
In the last 30 years, we've gone from a country where there was no legal state, either medical or adult use, and in that period of time, we now have 37 states where at least some form of cannabis is legal. 21 states, it's fully legal. The American public overwhelmingly supports it, and yet the federal government is hopelessly out of step. I welcome the President's call to do a reappraisal of how we characterize this so we can have the federal government catch up with where the American people are as it deals with the reality of cannabis, and I look forward to working with you. I appreciate your notion of the prescription drug reform. The American senior, primarily, does not have to pay 2, 3, 4, 5 times the world price for prescription drugs in order to underwrite medical research for the rest of the world. I'm not certain that the pharmaceutical companies would hold us hostage, but I think it's too steep a price. American consumers, especially seniors, should not be held hostage, and I appreciate the work you're doing implementing this bidding effort. Let me just touch on one other area. We have talked about some of the concerns we have, for example, in terms of for-profit hospice, where we found shadow companies that have buildings, get money, but have nobody that they're serving. I noticed that you have $5.2 billion for program integrity. Can you talk about what that's going to enable us to do to make sure the taxpayer is getting full value?
Congressman, we know that during COVID, we had more people die in nursing homes than was acceptable. We know that in too many cases, people are profiting off of saying that they're caring for some of our most precious loved ones who need help. And we want to make sure we get to go in and do some oversight. We want to make sure Sunshine will be a good disinfectant when it comes to caring for our loved ones. And so we hope you will consider truly consider our request for more money so we can do the oversight. I speak as a former Attorney General who worked hard to go after some of this abuse against elderly Americans, and we're going to do as much as we can.
I think you will find bipartisan support on this committee to deal with the integrity of the hospice program so we're not cheating patients or the government.
Amen.
I yield back.